Hi there YouTube family. For those of you with migraines and muscle pain at the back of the head, I'm going to explain to you what the problem is, what a solution is, and I'm going to show you one of my most powerful game changer adjustments. We're going to get going right now. I'm Dr. Craig Heinsohn, founder of Loving Life Chiropractic Canada. On this channel, we cover tips and exercises to reduce neck pain and migraines and correct upper and lower spine nerve issues. So if this would add value to your life, boop the like, spank the subscribe, and ding the notification bell to all. To get context and some great resources, watch all the way to the end, and in the description, I have some related material you may enjoy. First, I'm going to demonstrate some anatomy and show you the neurology which may affect migraine pain at the back of the head, and later a practice member has kindly agreed to volunteer to allow me to adjust her and show you what I'm doing. And I'll be using an occipital lift type adjustment, which is my personal preferred method of adjusting people who've been suffering for a long time with migraine pain coming from the back of the head. So let's get to it. So for me, as an upper cervical focused chiropractor, the back of the head is a very exciting area. There are 3 bones which have a very big impact on the nervous system and thus the control and function of the body. The first bone I'm going to discuss is called the occipital bone, and it is part of the skull, and it's surrounded here by the green line. Comes all the way down and goes around under the hole in the base of the skull. The hole's Latin name is foramen magnum, which means big hole. And then either side, you'll see 2 red areas, which are sliding surfaces. And they're called condyles. And it allows the head to move in this direction and that direction, a little bit like the pirate ship at the fairground. Now, the first vertebral bone of the spine is known as C1, and it is atypical. So unlike the rest of the bones in the spine, it is a ring. Is ring-like, and these red surfaces either side match with the skull, and the skull moves on that surface up and down. Now the cool thing about this bone, which is called atlas, a little bit like holding up the weight of the world, it holds up the weight of the skull. Atlas not only has this motion going, but there is a pin that it sits on that it rotates around. So rotation, looking over the shoulder type motion, also comes from this one bone. So there's 2 different ranges of motion coming from that one bone. Now the third bone in the skull is known as C2. C2, again, is atypical. It's not quite a ring. It has a little body on like the rest of the vertebrae, but what it does have, which is atypical, is a pivot point. That pivot point is called the dens, and it allows C1 especially to rotate around it. This gives 45 degrees of motion to the neck from that one joint. Now, not only do nerves exit between spinal bones, but also within the muscles, within the ligaments, there are tiny nerve receptors called motor receptors and proprioceptors, which also feed back signals to the brain. So if the body is stressed enough, and there are thousands of examples of how stress from life can affect the body, or if a weakness develops, the nerve system is not able to carry out the commands of the brain, and the nerve muscle body system gets stuck in a state of nerve interference processing, where it's trying to correct but isn't able to. This is a chiropractic subluxation in my office, and this is what I'm an expert at correcting. Now, one of my practice members has kindly agreed to be filmed while I conduct an occipital lift adjustment, which is a definite game changer adjustment for me when correcting upper cervical subluxations. Hi there, so this is Heather, and she is awesome. She's been suffering for many, many years with migraines and headaches. She had a concussion accident a few years ago, and today I've checked her just before we started shooting, and there is her occiput at the back is out of balance to the right hand side, so we're just going to do a occipital lift. Now a check again afterwards, super important, and just under there you feel the difference as well, right?
I do.
Yeah, beautiful. Yeah. And she's been under care for a few months now, and migraines and headaches, how are they doing?
Much better.
Much better. Beautiful. Thank you very much. So I trust this has added value to you and your situation, and if it has, please boop the like button, spank the subscribe button on the left and below, and ding the all notification bell to be informed when I drop the next video. Drop any comments you have down below and I'll circle around and check them out. And right down below here there are two links. One is a link to migraine playlist with some home help stretches and stories from other migraine sufferers, and the other piece has been specially selected for you. I'll see you on the next one. Dr. Craig out.